Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about one of the most important part in anatomy, the anatomy of heart. Heart is a vital organ in our body. You all know that. So the heart is a hollow muscular organ and it is somewhat pyramidal in shape. You all can see it is like pyramidal in shape. I'll show you a 3D picture as well. Here you can see nicely the heart, and it is like globular, somewhat globular, and you can see it is pyramidal in shape. And here very nicely. Then you can see its base. This is the base. So in the base, it is connected to great vessels, and otherwise it is freely lies within the pericardium. So, when we talk about the surfaces of the heart, there are three main surfaces of the heart, and they are the sternocostal surface or the anterior surface. This is the sternocostal surface or the anterior surface, and then this is the diaphragmatic surface or the inferior surface. Then this is the base or the posterior surface of the heart. This is this picture you can see the anterior surface of the heart. So it is mainly formed by the right atrium and the right ventricle, and also you can see part of left ventricle as well as part of left atrium, which is a left auricle as well. So the right border is formed by the right atrium and left border formed by the left ventricle mainly, and part of left atrium, the left auricle, also involving formation of this left border of the heart. So you can see in the anterior aspect of the heart, the two ventricles, the right ventricle and the left ventricle, is separated by anterior interventricular groove. And here you can see the right atrium and the right ventricle is separated by vertical atrioventricular groove. This is the atrioventricular groove. Let's say about the diaphragmatic surface now. So you can see this is the diaphragmatic surface. It is formed by mainly the left ventricle and right ventricle. So part of right atrium, the inferior part of right atrium also contributes to this diaphragmatic surface. You can see the inferior surface of the right atrium. There is an opening for inferior vena cava as well. So this left ventricle and the right ventricle is separated by posterior interventricular groove. Here, this is the posterior interventricular groove. Let's see about the posterior surface or the base of the heart. So you can see this is the base of the heart. You can see it is mainly formed by the left atrium, and you can see the four pulmonary veins opens into the left atrium, and this base lies opposite to the apex of the heart. So then we will see about the apex. You can see this area is the apex. You have to know where the apex is located. It is very important in clinical anatomy. When we auscultate the apex beat, you have to know where it is situated. So this apex is mainly formed by the left ventricle, and it is directed downwards, forwards and to the left. Then this apex lies at the level of fifth left intercostal space, 9 centimeters away from the midline. You locate 9 centimeters away or in the left side from the midline. In a living object, this apex beat can be palpated as well as sometimes we can see as well. When we talk about the borders of the heart, the right border is formed by the right atrium, the left border formed by left auricle and the left ventricle. Then the lower border is formed mainly by the right ventricle, but also there is a small part of right atrium is also involves in formation of the lower border of the heart. Then the I told you earlier as well, the apex is formed by left ventricle. These borders are very important to recognize when examining a radiograph of the heart. So you have to remember from which chambers these each border is formed. Now let's see the each chambers in detail, or the interior aspect or the features of the each chamber separately. So first I will going to discuss about the right atrium. So here you can see the cut section of right atrium, or it has open, and here you can see smooth wall part and rough wall part here. So this smooth wall part lies posteriorly, you can see very well. Then this rough wall part lies anteriorly. In the muscular area, or the we call them as rounded trabeculated muscle fibers. We call them as musculi pectinati. Musculi pectinati. They runs from the crista terminalis. This is the crista terminalis to the auricle. So you can see this rough wall part and the smooth wall part is separated by the crista terminalis interiorly, or the interior aspect. So there is a corresponding line to the crista terminalis called sulcus terminalis in the external aspect of the heart. So it is actually at the junction between the right atrium and the auricle. There is like a ventricular groove. So sorry, ventricular, not ventricular, the vertical groove. This smooth wall part is derived from sinus venosus, while this rough wall part, or this part, is derived from primitive atrium. Then there are several openings into the right atrium. You can see the inferior vena cava is opens here, and superior vena cava opens into here. So the superior vena cava opens into the upper part of the right atrium, and you cannot see any valve here in the opening of the superior vena cava. Then the inferior vena cava opens into the lower part of the right atrium. You can see there is a valve like structure, but it is a rudimentary non-functioning valve. This is a rudimentary non-functioning valve. Also here you can see an opening. It is the opening for coronary sinus. Here also you can see a valve-like structure, but it is also rudimentary non-functioning valve. Here you can see the fossa ovalis and limbus of fossa ovalis around it, and it represents the fetal foramen ovale. It represents the fetal foramen ovale. Then here the orifice, right, atrioventricular orifice, here you can see the tricuspid valve as well. It lies anterior to the inferior vena cava opening, and it is guarded by the tricuspid valve. Many small orifices of small veins also drains the wall of the heart and opens directly into the right atrium. Remember that as well. Now let's see what are the important features in the right ventricle. The right ventricle communicates with the right atrium through atrioventricular orifice, and with the pulmonary trunk through the pulmonary orifice. As the cavity approaches the pulmonary orifice, it becomes funnel in shape. This area is funnel in shape. At this point, it is known as the infundibulum. The walls of the right ventricles are much more thicker than the walls in the right atrium, and there are projecting ridges formed by the muscle bundles as well. So we call them as trabeculae carneae. It gives like a spongy-like appearance to the ventricle also. So the trabeculae carneae are composed of three types, and the first type is the papillary muscles. You can see these papillary muscles projecting inwards from the wall of the right ventricle, actually there are three main types of papillary muscles. This is the anterior papillary muscle, this is the posterior papillary muscle, and this is the septal papillary muscle. Each of these papillary muscle is connected to the valves of the or the cusps of the tricuspid valve with chordae tendineae. This chordae tendineae joins the cusps with the apices of the papillary muscles. You can see very well. The second type of trabecular carneae is attached at the end of the ventricular wall and being free in the middle, and they are this septomarginal trabeculae. We call it also the name moderator band as well. So this crosses the ventricular cavity from the septum to the anterior wall. So this septomarginal trabeculae or the moderator band conveys the right branch of the atrioventricular bundle. You know, it is a part of conducting system of the heart. The third type of trabecular carneae is simply composed of prominent ridges. Then this is the tricuspid valve. It has anterior cusp, then the septal cusp and the posterior cusp. There is a clinical importance of this papillary muscles, chordae tendineae, and the cusps of the tricuspid valve. If there is a myocardial infarction or myocardial necrosis, then these papillary muscles may not be functioning. So, then the corresponding cusp of the tricuspid valve may be bulged into the right atrium during this systole of the right ventricle. So, that bulging of the tricuspid valve into the right atrium during systole of the right ventricle is prevented by the chordae tendineae attached to these papillary muscles. When those chordae tendineae contracts, these cusps are prevent from bulging into the right atrium during the systole of the right ventricle. You have to remember that as well. So let's move on to the left atrium. So here you can see the left atrium, the internal structure. There is a valve of foramen ovale, and here you can see the smooth wall part and the orifice, interventricular atrioventricular orifice, and openings of the pulmonary veins here, and here the left auricle. So the left atrium also similar to right atrium, and it is consist of main cavity and left auricle. The left atrium is situated behind the right atrium and forms great part of the base or posterior surface of the heart. Behind it lies the oblique sinus of the serous pericardium, and the fibrous pericardium separates it from the esophagus. There is an important relation with the left atrium and the esophagus. You have to remember that, because in mitral stenosis, this left atrium can be enlarged and it can compress it can forms an indentation in the esophagus, and it is the clinical importance of this. You have to remember that. Then the openings for pulmonary veins, two from each lung, opens through the posterior wall and they have no valves, and the left atrioventricular orifice is guarded by mitral valve. Then the left ventricle, the internal features of the left ventricle here. The left ventricle communicates with the left atrium through atrioventricular orifice and with the aorta with aortic orifice. In the aortic orifice, there is a semilunar valve with three cusps as well. Here, you can see only two papillary muscles as anterior papillary muscle, or this is anterior papillary muscle and posterior papillary muscle, and these muscular ridges you can see well, trabecular carneae. This is the left ventricle is more muscular than the right ventricle, and also it bulges the interventricular septum into the right ventricle, and you will see in a cross section as like this. I'll show you here. This is the left ventricle, and this is the right ventricle. This is the left ventricle and this is the right ventricle. You will see like this in a cross section, because the more muscular wall of the left ventricle bulges the septum, interventricular septum, towards the right ventricle. So the cross section appears like this. Then you can see this is the mitral valve. It also has only two cusps. This is the anterior, this is the posterior cusp, and this is the anterior cusp, because you are facing this side. You are weaving from the posterior aspect of the left ventricle, and this part or this wall is the anterior wall. So this is the posterior cusp and this is the anterior cusp of the mitral valve. Now I am going to discuss about the blood supply or the arterial supply of the heart. Here you can see this is aorta, and the arterial supply of the heart is provided by right and left coronary arteries, which arising from the ascending part of the aorta immediately above the aortic valve. The coronary arteries and major branches are distributed over the surface of the heart, lying within the subepicardial connective tissue. So the right coronary artery here, it arises from the anterior aortic sinus of the ascending aorta and runs forward between the pulmonary trunk, here the pulmonary trunk, and right auricle. It descends almost vertically in the right atrioventricular groove, and at the inferior border of the heart, it continues posteriorly along the atrioventricular groove to anastomose with the left coronary artery in the posterior interventricular groove. The following branches from the right coronary artery supplies the right atrium, right ventricle. Also some branches gives to this left ventricle as well as left atrium. And also mainly it supplies to the SA node and AV node. When we talk about the branches of the right coronary artery, there is a right conus artery which supplies anterior surface of the pulmonary conus. This area is the pulmonary conus. So the branch gives to this area is right conus artery, and the upper part of anterior wall of the right ventricle. And then next, the anterior ventricular branches. There is 2 to 3 in number, anterior ventricular branches, and they supply anterior surface of the right ventricle. This is the marginal branch, which is the largest branch and largest branch of the anterior ventricular branches, and it runs along the lower margin of the costal surface and reaches the apex. Then there is a branch called posterior interventricular branch, and it runs towards the apex in the posterior interventricular groove. It gives off branches to the right ventricle as well as to the left ventricle, including its inferior wall. Then this branch, posterior interventricular branch, supplies the posterior part of the ventricular septum, but not the apical part. It supplies only the posterior part of the ventricular septum. And this apex area is supplied by anterior interventricular branch, which is a branch of left coronary artery. So there are some atrial branches which is arise from the right coronary artery, and they supply right atrium as well as the left atrium, and mainly SA node and AV node. And then when we talk about the left um, coronary artery here, this is the left coronary artery. It is usually the larger than the right coronary artery, and supplies major part of the heart, including greater part of the left atrium, left ventricle, and the ventricular septum. This arises from the left posterior aortic sinus of the ascending aorta and passes forward between pulmonary trunk and left auricle. Then it enters into the atrioventricular groove and divided into anterior interventricular branch and circumflex branch. Then the anterior interventricular branch runs downward in the anterior interventricular groove to the apex of the heart. In most individuals, it then passes around the apex towards the posterior side to enter into the posterior interventricular groove and anastomose with the terminal branches of the posterior interventricular branch, which is a branch of right coronary artery. And in 1/3 of individuals, it ends at the apex of the heart. The anterior interventricular branch supplies right ventricle and left ventricle with numerous branches that also supplies the anterior part of the ventricular septum. And then there is a one major branch arising from the anterior interventricular branch, which is called as lateral branch of anterior interventricular artery, or left diagonal branch. This diagonal branch arises directly from the trunk of the left. Sometimes it can arises directly from the left coronary artery as well. Then there are small cornus artery which supplies the pulmonary cornus. Then this is the circumflex branch of the left coronary artery, and it is same size as anterior interventricular artery, and it winds around the left margin of the heart in the atrioventricular groove. And this is the left marginal branch, which is a large branch of the left circumflex branch, and then it supplies to the left ventricle uh, towards the apex. Anterior ventricular and posterior ventricular branches are there which supplies left ventricle as well. Here you will see the right coronary artery coming from anterior aortic sinus in between this pulmonary infundibulum and the right auricle, and here the right coronary artery going in the towards the posterior side and posterior atrioventricular groove. Then here it is terminates, and then here the posterior interventricular groove. Then here you can see the circumflex branch, and this is the left marginal branch. Here you can see the left marginal branch, and here the anterior interventricular branch. Do you know about right dominance and left dominance? Actually, this concept is very important concept, or this variation. You will be asking why was what is right dominance or what is left dominance. This is a variation in coronary arteries. The variations in the blood supply to the heart do occur, and most common variation affect the blood supply to the diaphragmatic surface of both ventricles. Here, the origin, size, and distribution of the posterior interventricular branch. Here, the posterior interventricular branch is variable. The right dominance means the posterior interventricular artery is a large branch of right coronary artery. We call those as right dominance. Right dominance usually present in about 90%. Most you can see the right dominance. The left dominance means the posterior interventricular branch arising from the circumflex arteries or the circumflex branch of the left coronary artery. So it can be seen only in 10% of individuals. So that is right dominance and left dominance. This right dominance and left dominance mainly depends on the variation of the posterior interventricular branch. Hope you understand clearly. Here I am going to discuss about the venous drainage of the heart. Here is a posterior inferior view of the heart. Here is the coronary sinus. The most blood from the heart wall drains to the right atrium through coronary sinus. This is the coronary sinus which opens into the right atrium. So you can see the tributaries of coronary sinus, the oblique vein of the left atrium. This is the left atrium. So it coming from the left atrium, and then you can see the small cardiac vein, and then you can see the middle cardiac vein, posterior vein of left ventricle, left marginal vein, and the great cardiac vein. Those are the tributaries of the coronary sinus. Here you can see the great cardiac vein. This is the great cardiac vein. It is in the posterior part of the atrioventricular groove and opens into the coronary sinus. Then the small middle cardiac vein. This is the middle cardiac vein. It is in the posterior interventricular groove, correspond to the posterior interventricular branch of right coronary artery. So the anterior cardiac vein, these are the anterior cardiac vein, they drains blood directly into the right atrium. This anterior cardiac vein. So you can see anterior cardiac veins crosses vertical right atrioventricular groove and opens into the right atrium directly. So you can see the smallest cardiac veins or venae cordis minime, they opens directly into the cardiac or the heart wall of the right atrium. Here in this 3D picture, you can see the coronary sinus in the posterior aspect of the heart, and it opens into the right atrium here. And then these are the tributaries, middle cardiac vein, and then you have the small cardiac vein, and you have the oblique vein of the left atrium here. Then you have here the great cardiac vein, and then this is another tributary which is the great cardiac vein. Here again small cardiac vein, and you can see the apex area and how they are open into the heart wall. So that's all about I have to discuss about the heart in this video, and hope you guys well understood about the interior features and the interior aspect of each chambers and the blood supply and the important aspect, the right dominance and the left dominance of the heart. You may be asked in vivas what is left dominance and what is right dominance, so you have to remember that very well, how it occurs, what is the artery responsible for this right and left dominance. And then if you like this video, please share with your friends, and please subscribe into my channel for more videos, and please put a comment and in the comment section and put a like, and thank you for watching.